Okay, hi everyone. Hopefully you can see us and we are live. If not, we're literally talking to ourselves for the next 45 minutes of ourselves.
Or each other.
Or each other, right? So those who don't know me, Dr. Alanna Kennedy-Nasser, everyone calls me Dr. Alanna. And today our guest is Dr. Alanna Bree, who I describe as the pediatric dermatologist extraordinaire. I get asked so many rash questions. It's probably the number one question I get asked all the time. I get pictures of rashes all the time. We have this Secure OMD app, which I call OMG, because I get pictures of all sorts of rashes. So we'll take this one moment to say, if you have pictures of strange rashes, you don't have to send them to me, but I do get them all the time. But please, only if you're one of my patients.
Yeah.
But oftentimes, if I don't know what it is, I get a hold of Dr. Bree and say, what is this? So I'm going to have her introduce herself, because she can do it better than I can, and then I'm going to hit her up with a bunch of questions that we have, and it's the most common questions that I get as well. So, perfect. Thanks for coming.
Yes, thank you for having me. I'm excited to be here. Pediatric dermatology is what I do. It's awesome. I think I have the best job in the world. And as a pediatric dermatologist, we have training in pediatrics. So developmentally, children are much different than adults. So I think adult dermatologists are great, and they're trained in pediatric dermatology, but we actually do an extra year fellowship training in pediatric dermatology specifically because children do have different types of skin issues. And then if you have to do a procedure on a child, I think having somebody that has training in the developmental stages of pediatrics can do it a lot better. So pediatric dermatologists, there's only 326 of us in the country, so not a whole heck of a lot of us. And all of us that I know really love our jobs because we really do have the best jobs ever. So helping kids love the skin they're in is what I do. Help them feel better, and then also just understand how to take care of their skin is something that I really enjoy doing and teaching them. So yeah, that's what I do.
Great. What is the name of your practice?
Yes, my practice, it is called a Children's House for Pediatric Dermatology, and it's a small kind of boutique practice. It's in Montrose in a house. It's really comfortable. We use a direct patient care model, so we don't take insurance, so we can focus on patient care, which has been a real breath of fresh air for me. We get to spend at least a half an hour with every one of our patients, going over good skincare and really helping people understand how to treat their skin conditions. When they walk out of the office, I feel like my patients are well educated and know what the plan is. And then it also allows me to support our nonprofit called the Children's House for the Soul, which I founded in 2015, and Dr. Lane is on the board of directors as well. But the social, emotional, spiritual side of skin disease is really something that's not really well supported in children, and a lot of times I say it's really easy for me to write a prescription or to do a laser treatment or a procedure, but really the more difficult part sometimes is addressing how the children and teenagers feel about their skin. So really that's the part of my job that I really love. So my office supports the nonprofit, and we have our first fundraiser coming up too.
Great.
I should mention that for sure. On February 9th at the Health Museum. It's going to be a really fun night. We have carnival games and a mechanical bowl, signature cocktails, light bites. Bill Brown of the Astros is going to be our MC for the night.
Great. So we'll put all of that information at the bottom, so if you're interested, and we'll definitely put the information for your practice. I know my patients have found it. They love it. They always come back and say, wow, they tell me, like, you're really smart, but Dr. Bree's really, really smart. I'm like, thanks.
Thanks.
I'm glad I have smart friends.
Yeah.
Okay, so I'm going to briefly tell you the kind of the joke in med school of what we learned about dermatology. And literally, and I remember being told this, thinking there's no way this is true, but what we were told was, listen, if say the rash is wet, dry it. If it's dry, wet it, and if it itches, put a steroid cream on it. And a lot of us left medical school going, and that was about the gist of kind of dermatology to us, and there's so much more to it. And we're not even sure if that's actually entirely true, which is why we have pediatric dermatologists. So that's not completely true, but
not completely true. And interestingly,
sometimes true.
Sometimes true. Sometimes
yes.
true. That is true. But yeah, the limited amount of dermatology that we get in medical school is unfortunate. So
yeah,
I mean, it's a 3-year residency, an extra year of pediatric dermatology. So there's textbooks, and they're like, oh, it's just a rash. What is it? And I'm like, well, there's this textbook that's about this thick, full of all these rashes. So it is very specific. But 30% of children will go to their pediatrician with a complaint about their skin. 30%.
Yes. Oh, I believe it. I think it's more than 30%. Because I feel like every single patient I have, they say, oh, and by the way, what's this rash?
Right.
And so it literally is the most common thing I get. Okay, so I was going to ask you about a few of the most common ones, and we had some questions. And so what is the most common rash that you see in your office, or most common reason someone calls you or shows up in your office?
I would say probably eczema is the most common rash
Eczema.
that we see. Yes, eczema, or we also call it atopic dermatitis.
Yeah.
It is really, really common. 25% of children have eczema, and it is interchangeable with the word atopic dermatitis. That's the $10 doctor word that you get for it, right?
Yes, yes.
But exactly the same thing. Interestingly, a lot of people want to blame the cause of eczema on food. And sometimes kids have food allergies. Kids with eczema do have a higher chance of having food allergies, asthma, seasonal environmental allergies, but it's really not the cause. They're definitely interrelated, and our immune system is interrelated. So anything that revs up your immune system will make eczema worse. But the primary issue with eczema is the skin barrier. So our skin, the whole reason we have skin is to keep good things in and bad things out, right? Mm-hmm. So our skin looks like a brick wall when you look at it underneath the microscope. And the skin cells are totally normal in eczema, the keratinocytes, but what's kind of disrupted, there's all these chemicals that make up the mortar in between the bricks of our skin, and that's what's not really working well. Filaggrin and all kinds of different things. So knowing that your skin barrier with eczema is leaky is kind of the most important thing for people to know.
Okay.
So it lets water out, so that's why kids' skin with eczema is really dry, because it can't lock in moisture. Water leaks out. And then the other thing is kids' skin with eczema is really sensitive because things get through the skin barrier and cause irritation. And then the next part is the inflammatory part. And these things get through your skin barrier and your body reacts to them, and that's what causes the inflammation or red spots, which tend to be on the little skin folds behind the knees, and the bends of the arm. That's kind of the classic places, but eczema can cover anywhere. Our skin is our biggest organ. It covers from your head to your toe. So
yeah, we forget it's an organ.
It
just
is.
like your heart or anything else. So.
Yeah, it's the most awesome organ in my opinion. But yeah, it's good, but you got to take care of it. So the most important part of eczema treatment is just good skincare. So basically, my motto for kids with sensitive skin or eczema is less is more. The less we expose the skin to, the less it can react to. So keeping things really nice and simple. I think sometimes people try to do too much, and it ends up leading to more irritation.
Right. Or especially using just things with fragrances or something else because someone told them use this or that. One of the worst things I hear all the time is someone say, well, I read it on this mommy blog. And I'm like, oh, especially medical stuff, I really recommend people not try to get their medical information that way.
Right.
Now, having said that, as she lists all these different rashes very expertly, we have written down the rashes so you can see. I hope you can read it. We also had to write it backwards, by the way, because everything's reversed. But anyway, so hopefully you can see that. It says eczema. It's very rare that I tell people to Google things, but sometimes when I'm, say, telling someone about eczema or telling them about a certain rash or something, I'll say the name of it, and they're just like, what in the world did she just say? And so sometimes I will then Google it in the office, show them other examples that, go to Google Images. Now, having said that, when you sometimes go to Google Images, you see all sorts of other stuff, some things you can't unsee, to be quite honest.
Right.
But in general, if you Google it and then you end up on a very reputable website, especially one from, say, a pediatric hospital, etc. Cleveland Clinic is one example I give, and I'll end up listing, some things we talk about. The Cleveland Clinic actually had some really good information about these things, and so we'll end up putting at the bottom of the little broadcast thing.
Yeah,
and
but
so,
the American Academy of Dermatology has good information, Society of Pediatric Dermatology.
Right. So it helps to sometimes look at these rashes as we talk about them, because some of these words are pretty big, and we all joke we only went to med school so that we could say really big words like atopic dermatitis and let it roll off our tongue quite well.
That's right.
Okay, so another one that's super, super common that I get in office all the time is Molluscum contagiosum. And here's what Molluscum contagiosum, how it's spelled. And I kid you not, the most common question, I'll say, oh, that's Molluscum contagiosum. It's very distinct. It's very easy to identify in general, and it's very, very quick. And it always feels good to look at it and go, oh, that's Molluscum contagiosum. Do you know what the number one question I get asked next?
Is it contagious?
Is it contagious?
Yes, it is.
Of course it is. First of all, in general, just when people ask me if things are contagious, most things are.
Yes.
In general. So just whenever people ask that, I'm like, everything of it pretty much is contagious. But this one has the word contagiosum in the name, and it is contagious, and you can describe it for us. Yes. And feel free to Google a picture of that. It's very distinct.
Yes, very distinct. It is, probably the second most common thing that I see in my office, for sure. And my saying about molluscum is that if you're a kid and you have skin, you will get molluscum. period. So every kid is gonna get it. It is the new chickenpox. It is in the chickenpox family. It is the replacement of chickenpox for this generation, basically.
But having said that, it doesn't make you sick.
It doesn't make you sick, and that's the great thing about it.
Yeah, the big difference with chickenpox, for those of you who ever had it, and the last time I saw chickenpox was my own children who were much older, before the vaccine was available. And so we don't really see chickenpox much at all. And chickenpox actually is a bit of a bummer and itched quite a lot.
And that's why we have vaccines.
Right, and so we don't see that anymore. And molluscum, in general, doesn't really cause problems.
No.
And the other big difference between it and chickenpox is it lasts much longer.
Yes.
And I think that's the part most parents have a problem with. So what's the average length of time? And so in case you haven't Googled it yet, molluscum are little round, we call them pearly, meaning kind of the color of your skin, and they're umbilicated little bitty lesions. And so I always get a picture, and they can also self-inoculate so that it goes from here and then it's over here and other here. And then sometimes it's quite widespread, and I've only seen it be a problem in immunocompromised patients.
Right. That's usually, usually on average, most kids get about 20 bumps scattered about. It's hard to predict how many your kid's going to have.
Right.
But about 20 to 30 bumps would, I'd say, be average. And on average, it lasts about 2 years. So it is a long time to wait it out. But the good news is most of the time it doesn't cause much trouble. They can get a little red and inflamed and irritated, get a little bit of an eczema around them as your body kind of wakes up to them and tries to fight them off. And they can go away with a small scar. That's pretty rare. They are in that pox family of viruses, but most of the time, I'd say 99% of the time, they go away totally fine. Interestingly, there's nothing FDA approved to treat molluscum. So
nothing FDA approved.
Nothing.
Let's talk about the things that aren't FDA approved then.
Yes. So there are a lot of things that we use off-label. Not to say that there aren't things that we don't do, right?
Right.
So I do think it's really important in all things that we do as physicians not to make the treatment worse than the problem. So I think molluscum is a good example of that. It's a benign condition, not going to kill your kid, and it will eventually go away even if you do nothing, right? So to make the treatment worse by holding your kid down and scraping these off or freezing them off or burning them off, I think is a real tragedy, because then your children are scared of the pediatrician. They have a higher rate of scar. Those are things that can be done, and there are people that do that, and there are people that choose to do that with their children, and I understand that. But I really think that if we can make this as tolerable as possible for our children as we go through it, that's the better thing to do. So the great thing is apple cider vinegar. Apple cider vinegar, I knew you were going to like it.
It works for so many things,
so many things. But believe it or not, anything that you put on topically to cause a little bit of irritation is what's going to help make these your immune system wake up and kind of chase away the molluscum. So apple cider vinegar is great. It does cause a little bit of irritation. You don't want to put it on with a cotton ball. You really want to use it with a Q-tip. But once a day for that, most kids can tolerate. There are some other over-the-counter products. Conzerol is one. It's made from the bark of the thuja tree. It makes little black dots. One of the little kids I saw said, "It's my chocolate chip medicine," because it turns them like black before they go away. There's one, it's really smelly. It's called Zymoderm, but it does work. It's basically iodine that dries them up. Another one that just came out, it's an essential oil. It's been around for a long time, but a study just came out in the last couple months that showed that lemon myrtle oil can be helpful.
Interesting. It's really rare that you have a MD dermatologist and the word essential oil come right out together.
Yep, that we believe in holistic care.
That's great.
What we do. Yep.
That's good. I mean, because I do agree. I think less is more, and I think the bigger thing I see is parents sometimes freak out about this condition.
Right.
When I'm like, oh, no, everyone just kind of gets it, and the less you worry about it, probably the better.
Right.
And it's just not going to harm your child.
It's not. And as far as it being contagious, it's kind of like a wart. It's going to last 2 years. You can't avoid spreading it in some ways, really, and just touching it isn't going to spread it. So if your kid has a rash around it, please moisturize their skin and keep their skin happy and healthy, because if they start scratching it, that's when they pull the virus out of the central part. So it's good to moisturize and keep the skin healthy so that they don't get so irritated with it.
Right.
So
that's when they self-inoculate.
Yes.
Okay, so you mentioned wart.
Yes.
So I feel completely obligated to ask
another wart
about
virus.
About the warts. So I'm hoping you all can spell warts sluggish skin.
Yes, warts. It also goes by the fancy doctor name of verruca vulgaris.
Which is what we use because
Yes.
it was all these years of med school had to fail somehow.
Yes, and Willy Wonka, verruca
Yes.
salt.
Yes.
It means wart, verruca.
Yes.
And vulgaris, actually, the word vulgaris means common, so it's a common wart.
Which is funny because you think it means vulgar.
Right,
Right.
but it means common.
Common wart.
Common wart. So common warts are common. They are caused by another virus in a different family, in the HPV virus family. Usually types 1 through 3 are the most common for common warts. The virus is really amazing to me. I'm a total dermatology nerd, like I really am, because this virus is intriguing to me.
So you can tell a nerd. I mean, I love you to death, but
It's okay. I love my job. But this virus, it is smart. It knows that it does better in thick skin. So that's why it goes to your hands and your feet and your knees and your elbows.
Mhm.
Like, it's smart.
It is.
And it gets in your skin, and there's machinery in the virus to tell your body to make extra skin. So that's why it gets thick, because it tells your body to make that extra skin to protect it. So, and then those little black dots that some people call like the roots and the seeds, those are actually little blood vessels that feed it. So it sets up this happy little home that's protected from your immune system, has a food supply, and that's why it grows, and your body doesn't really recognize it. So as far as warts go, they on average will go away in about 2 years, so you don't have to treat those either. But most kids do want to, and they can spread. Luckily, they don't tend to be on the face. They do tend to be in other areas, but a lot of kids are very self-conscious if they're on their hands. So there are a lot of people that burn and freeze and scrape warts, and that is something that we do. Basically, I describe that as what you're doing is you're blowing the house up that the virus lives in. Basically, you're destroying that skin that the virus lives in. But a lot of times, because the virus is in the normal skin, it just kind of comes in and rebuilds the house, right? So I'm not a huge fan of freezing because it's uncomfortable, and it doesn't tend to work the first time. Usually you have to come back in. So interestingly, I went through all the literature to kind of find out what else is out there that doesn't traumatize our kid. Interestingly, zinc sulfate is something that you can supplement. I think it's 10 milligrams per kilogram. I'd have to look up the dose, but it comes as a 220 milligrams capsule. Okay. And you can get that over the counter, but zinc sulfate. Interestingly, they did a study that showed thermotherapy. So basically heat can get rid of warts, and basically you can hold a heating pad. I've heard the sunbeam heating pad. I have no stake in the game here.
Yeah. No stock.
Yes, no stock. But sunbeam gets the hottest, but without burning. And you hold it on the area of warts for 30 minutes once a week.
Wow, 30 minutes.
30 minutes.
Okay.
Yep, that can be something that you can do that's pretty easy. Interestingly, positive visualization, which is basically kind of meditation. They did a study, honest to goodness, with children who went to sleep thinking about their warts going away. And those kids in that group went away more so than kids that didn't. So that's easy, right? That's easy. Yeah. Positive, basketball players, right? When they get up to the line and they've thought about making the basket, they make their percentage on goal is higher, right? So it's interesting what our brains can do. So that's easy.
We will look up that study.
Yes. But immunotherapy, I do a lot of immunotherapy for warts, and that just makes a whole lot more sense to me because your body's immune system, it's not that it's bad, it's just not seeing the virus because the virus is so good at hiding out. So immunotherapy, what it does is it gets your body's immune system involved, which is better because most kids that get warts tend to get warts again. Right. So this way, your body makes an immunity to it, makes antibodies to it. So we use a chemical called diphenylcyclopropanone.
It will take us a while to write that down.
It's a long one.
But I'm going to attempt it without you sort of Googling.
Yes, diphenylcyclopropanone. We call it DCP for short. But what that does, DCP, it makes a red flag to your immune system. We put this chemical on the skin, which doesn't burn, it doesn't hurt, it doesn't sting, and basically makes a red flag to the immune system. The immune system comes down, sees the DCP, figures out the virus is there, and your own body attacks the wart. The nice thing about it is you only do it for once a week before bed. Okay. Doesn't burn, it doesn't sting, it's well tolerated. We get it at a compounding pharmacy. You have to be sensitized to it in the office. We sensitize with a 2% solution in the office. Okay. And then usually people do a lower strength treatment once a week. Awesome. And usually after 3 months, it's gone painlessly.
Just a real, yes, we will tell you about drool rash. We're asked about drool rashes, which we will ask one minute. I do want to make one point real fast about drool rashes. One second.
Oh, yeah.
I do want to
really,
make
really.
one real quick point on warts. It's all about location.
Right.
We are talking about the warts on your hands and your feet, etc. We are not talking about genital warts.
Right.
And it's important to know the vaccine against the warts are not for the ones on the hands and feet.
Right.
So that is to prevent genital warts. And
Right.
So, totally different topic.
Totally
Okay.
different topic.
So moving to that, I do want to talk about a few newborn things because it turns out newborns have tons of rashes.
And I love the newborns. Send them my way.
And here's the deal with babies. People always say, "Oh, I want baby skin." I'm like, why? They're so rashy.
They are rashy.
I mean, they drool and immediately rash. So one question we had was about drool rashes.
Yes.
I'm a big fan of Vaseline
Yep.
to protect the skin and prevent the drool from actually irritating the skin. And
Right.
what are your thoughts?
Yep. So it is an irritant dermatitis.
Yep.
Basically, saliva is probably one of the
Dermatitis.
most irritating things that can contact the skin, and baby skin is very sensitive because it's kind of trying to figure out the world, and it goes from a wet environment being in utero to being out in the world, so it's learning to kind of transition between that wet, dry environment.
Yep.
So I think that's why a lot of times kids' skin is very sensitive when they're babies. But drool, once they start teething, forget about it. If they get a rash on their cheeks, they're pretty much going to have a rash, truthfully, until they quit teething. Because, unfortunately, and that's just giving you it straight, right?
Mm-hmm.
I mean, there are things we can do to make it better, but because drool is irritating and they keep doing what is irritating, it just, your skin barrier can't get healed all the way fully. But I agree, keeping the drool off the face, and again, it goes back to less is more. More times than not, people start to put things on the face that cause way more irritation.
Right.
So I think keeping it simple, just gentle cleansers. Vanicream is my very favorite product line, and that's what I exclusively recommend for all my patients that have sensitive skin. But
She has zero stock in Vanicream.
zero stock in Vanicream too. Zero stock. Yes, but
It's a great product.
it's a good. It was formulated by the dermatologist at Mayo Clinic. That's the only place you could get it for a while. They sold it to a real small pharmacy that's in up in Minnesota still. And you can get it on Amazon, Target, CVS now, but I always tease it's like the stuff at the bottom shelf that has the dust on it because it's not like marketed very well.
Yes.
It doesn't look beautiful, but it's wonderful. It doesn't have parabens, dyes, fragrance, lanolin, all of those things that we don't like. But yeah, just keeping a barrier on the skin is the most important thing. So either Vaseline is great because most people don't get irritated by it. Mineral oil is also another thing you can use. Vaniply is in the Vanicream line, which is their thick ointment that doesn't have lanolin because I'm not a big fan of Aquaphor because of the lanolin in it. But doing that, especially before eating, because that's most of the time kids drool more when they're eating or they get more irritation on their skin, and then also before they take a nap or go to bed, just because that's another time. So just putting a good smear or barrier, what you're doing is putting mortar in between the skin cells, so that then when the drool happens, because it's going to happen, then it doesn't really irritate the skin. So that's probably the most important part.
Well, speaking about drool dermatitis, which is up here, the other big thing we see is diaper dermatitis. And I think we do have, in case you can't spell dermatitis, because once again, we like to call it diaper rash.
Diaper rash,
But medically we call it diaper dermatitis. And so what is your, once again, no stock anything, but what's your favorite diaper rash ointment cream, and so how do we keep their behinds from...
So it's the same exact thing as up here. It's really an irritant dermatitis. Again, once they get a diaper rash, it's really hard to heal up just because of the fact that what's irritating keeps happening, right? So again, it goes back to barrier protection. So keeping it simple, again, Vaseline, plain old Vaseline petroleum jelly is great. You can also use Vaniply, and then things that have zinc oxide in them are really good products because they kind of stay on better. You can get plain zinc oxide at about 15%. If you have a really sensitive skin baby, usually the only thing that is it with the zinc oxide is beeswax and mineral oil, so that's very, very inert, and that you can usually get in the skincare aisle, like the wound care area, but just plain zinc oxide. I also like Vanicream has their own diaper rash cream that has less stuff. I'm not a big, so it's great, it's zinc oxide based. But I'm not a huge fan of like butt paste. It has balsam of Peru, which is actually a fragrance. And actually one out there, the diaper creams had boric acid in it for the longest time until just recently. So it is important to...
It's amazing. Sometimes when you read the ingredient list,
Right, yeah.
If you can't pronounce anything, that's probably a sign.
Probably not good. And then also you do have to be sensitive about plant-based things. Like a lot of people want to do organic and natural, which I am all for.
Right.
But unfortunately, a lot of these kids that have real sensitive skin have plant sensitivities. So if you crush up a bunch of plants and leaves and stick them in cream and then you smear that on your skin, that might cause some more irritation. Also, Neosporin, avoid it. Just never buy a tube of Neosporin ever, please. Do not do it.
Don't do it. If Neosporin calls us.
I'm sorry, Neosporin.
My name is Dr. Bree.
The Vaseline base of Neosporin is what gives you the benefit. It is providing the barrier. So they've done many studies after like skin surgeries and after biopsies, and they've actually shown that people heal better with plain Vaseline petroleum jelly as opposed to Neosporin. And they actually, in one study, had more skin infections in the Neosporin group than they did in the Vaseline group. Honest to God. It's the literature. You can't argue with the literature.
PubMed. So y'all, you know how y'all Dr. Google, we actually PubMed things, which is a little bit more legit.
Yep.
Can you hand me the seborrheic dermatitis? Oh, you might have actually. Oh, okay. So the other one I would talk about is another dermatitis seen in infants. It has a super fancy name, but I call it cradle cap because who can pronounce seborrheic dermatitis?
Right.
And so tell us all about it. I can tell you in general, it's yellow, it's scaly. It can just be picked off. And my husband, when one of our children had it, he would just sit there and watch TV. Just, I'm like, are you rubbing her head? Because I'm just removing all these little crusty things.
Yeah.
Turns out that was actually just as effective as probably anything else.
Yes. So
what is it, and why do they get it?
Yeah. So it's very, very common. It is, I call it infantile eczema because a lot of times seborrheic dermatitis doesn't just affect the cradle, the cap here. It affects kind of the skin fold. So baby eczema or infantile eczema, seborrheic dermatitis, cradle cap, they're all kind of the same thing. But it usually starts on the scalp, exactly as you described it, kind of yellow and crusty.
Yep.
But it tends to come behind the ears and the little creases there, the neck, the little skin folds, the little fat rolls that all these babies have. They get it there. It's red and kind of gooey.
Yeah.
And that is all seborrheic dermatitis or infantile eczema. And we treat it just like eczema, gentle skincare. You don't want to be too aggressive with exfoliating that. Like gentle exfoliation is fine. They have shown that yeast tends to overgrow in that scale because we think it's a little bit more oily. So we actually all have yeast on our skin and we live in conjunction with it and it actually keeps our skin healthy, but sometimes that can overgrow. There's a fancy type of yeast called Malacia furfur. Or Malacia pseudococcus. Yes, but that can overgrow a little bit in that scale. Basically, it feeds on that. So sometimes people will do like antifungal shampoos and dandruff shampoos. I think those are a little harsh for babies. I don't recommend those. The Vanicream line has free and clear shampoo, which is great. It's sulfate free. It doesn't burn or sting, but it's nice and gentle. And then they have one that has a zinc parathione in it, their medicated shampoo. In that line, and I really like that because it's a little bit anti-inflammatory. So I think that's helpful. And then a lot of times just leaving it alone if it's not bothering your child is probably what I would recommend. Again, I'm a less is more kind of person though.
But that's a good,
It is. And then you can treat it with a little bit of mild steroid if it's a little bit itchy or red and there's inflammation underneath it. Topical steroids, hydrocortisone 1%, you can use very safely in an infant if used correctly and not overused. It's very helpful, especially if they're symptomatic. And then certainly if it's more than that, seeing a pediatric dermatologist.
Yeah, I mean, I would at the very least say if you're to the point you think you're going to put a steroid on your baby, then you should at least see your pediatrician before ever putting a steroid on your baby.
Yeah, I agree.
I think that's
good recommendation.
Good recommendation.
Yeah.
Okay, so we're going to move a little bit away from babies, although I could probably talk about babies.
Yes, me too.
But I wanted to touch on another common skin thing that we see in the office a lot. Luckily, I don't think we normally have to send these to you, but we see it a lot. And so you know what it is. It's impetigo.
Impetigo, yes.
And
very common.
Once again, difficult to spell, but so freaking common.
Yes.
And this we usually do treat.
Yes, and it is important to treat. It's caused by staph bacteria. Everybody's like, oh, staph bacteria. We all probably have staph to some degree on our skin, and it's kind of waiting for an open cut or an area to kind of get in. So impetigo is real common in kids just because they're touching everything, they're touching each other, they're touching surfaces, and then also sports. A lot of kids that play sports are exposed to impetigo and staph bacteria because they're moist, warm and sweaty and all that kind of stuff. So Staph bacteria is not bad in general, but it can definitely cause some irritation, some redness, some swelling, and so we do want to treat it because it is infectious and communicable between people. So interestingly,
and I would say when parents call me and say they have this rash, that's these red areas, one of the first questions I ask is, by chance, do they look honey crusted?
Yes.
Because historically and classically, impetigo, if you've Googled it yet,
Yes.
are honey crusted lesions.
Yes.
And usually if you see a picture of it, or they even say, oh yeah, now that you mention it, they do look honey crusted, that's impetigo. And so that way,
so it's kind of yellow, crusty. I don't like to call it honey crusted because I love honey.
I know,
it grosses me out a little bit, but it is a good description.
It's
an excellent description, actually. And it can cause little pus bumps, especially around your hair follicles.
And even little bullae,
like little
bullous
blisters.
formation, and that I think freaks people out a lot too.
It can.
Yeah.
So, interestingly, dilute bleach baths, sounds crazy, but dilute bleach baths are great. You don't want to do too much because it's definitely irritating, but bleach is antibacterial and shown to be very safe, even in NICU. That's the NICU babies is what they did the first study on. And that decreases the colonization. So it's really about 1/4 of a cup of bleach in a full tub of water. You want to do non-fragrance bleach. And you do that, just kind of mix it in the water, and you can get it in the eyes and in the hair and all that at that level. But doing that once a week, it definitely keeps it down. There is an antibacterial cleanser called CLN that's pretty good. And then Hibiclens is also over the counter. Chlorhexidine is the generic name of it.
Yes.
But it does have, it's pink, and a lot of kids with eczema are very sensitive to colors and dyes and things, so sometimes they can't tolerate that one. So bleach is great. I like that a little bit better. Mupirocin is prescribed a lot for impetigo. Unfortunately, it's been overprescribed. So it used to be totally effective. Put it on, it would clear up in a couple days. Now about 30% of isolates in Houston are no longer sensitive to mupirocin because we just put it on open cuts and all that stuff. So it really is to treat true infections.
Right.
So
And that's also called Bactroban.
Yes.
And some of these impetigo lesions, they actually need more than just a topical antibiotic. Like we actually have to put them on oral antibiotics, which is why if you think your child might have that, I think it is worthwhile. And when the whole Harvey thing happened, we saw lots of skin infections, and I'd say the vast majority of those really required oral antibiotics, if not, in some cases, IV. So some of those skin infections
can be serious. They can be serious.
Yes, they can definitely get out of control quite quickly. Okay, so someone had a question, and it was, speaking of Neosporin, should we be paying attention to the skin flora with kids developing immune system? Like practical tips for their skin flora. Everyone has skin bacteria.
Right.
And I think that that's very, very normal. Like all of us have Staph epi, for example, in our skin.
Yep.
And so we actually consider that a contaminant. If we do a blood culture and the only thing is a Staph epi, then we're like, well, that's their skin bacteria.
Right.
So, and we all have bacteria in our throat and everywhere else. And I think it's important to notice, like you said, that even yeast and stuff in normal amounts is normal.
It's normal.
The problem is that when things grow in too much.
Right. So it's kind of like Goldilocks and Three Bears. You want it just right, not too much, and not too little.
So for example, by overdoing, say, oral antibiotics, so if you treat everything with amoxicillin, you will destroy a lot of the skin flora and your gut flora and all those things too. So I'm a big proponent of probiotics. I think they're very important to these immune systems as well.
Yep.
And so,
and they've shown in some studies that eczema, that actually probiotics can be helpful. There's other studies that show it's not as effective, but I think that it's a good thing to do because again, it's really safe and well tolerated in a lot of these kids, and I do think it can help in some. Interestingly, the whole thought of eczema that makes the most sense to me is the hygiene hypothesis. Some people call it the eat dirt hypothesis, where we're actually too clean. So all of these kind of antibacterial cleansers and all these hand gels that we use are actually not good for us because our bodies need to kind of develop a tolerance to things. And they've shown that kids that grow up on farms that have more antigenic exposure actually have less eczema, asthma, allergies. So I think it's very good to let your kids play in the dirt. I mean, of course, take care of their skin, but keep it simple. Don't use all these products that have so many chemicals. And interestingly, they can label there's so much marketing that the skincare products, it makes me a little sick. You can label something unscented if you don't smell scent, but it can have actually fragrance chemical in it and masking fragrance so that you don't smell it, and they can label it unscented. So you really do need to be aware of what is in your product.
Right. Because it's not just the fact that you can smell it. That's the problem. It's actually
got the chemical in it is, and that's what we're trying to avoid. So yeah, I think keeping it simple. Gentle skincare, the Vanicream product line I think is great. They've shown that if you start moisturizing, the most important thing of preventing eczema is starting moisturizing your newborn right away, and it doesn't matter what you moisturize with, sunflower oil, they use Vaseline. In that study, they did Vaniply, and they were all effective, basically just keeping that skin barrier healthy.
Right. So I agree, and so I think the study I saw showed if you Vaseline all babies from go, like you would decrease the eczema rate dramatically. And so apparently we're just not using, but you don't like Aquaphor.
No.
Ixnay on the Neosporin.
Ixnay on the Neosporin. Ixnay on the Eucerin. Ixnay on.
Thank goodness I don't know who owns Neosporin, so they're not going to call us up. So one other thing that I did want to touch on, and then I'm going to ask you at the end, and it's a few just quick bullets, like your favorite X. Okay. And so I do want to touch on keratosis pilaris.
Yes, keratosis pilaris.
This one is super common. I see it all the time. Matter of fact, I have this. Yes. And I use a product called Amlactin.
Yes, Amlactin.
Which is over the counter. It's alpha-hydroxy acid. It works quite well. One of my daughters has this. And it's really not a problem.
It's not a problem.
Parents worry about it a lot.
Yes, it's genetic. It's autosomal dominant. So if you have a child that has it, either the mom or the dad has it, because that's how you get it. Yep. So start feeling your arms if your kids have it.
They feel like chicken bumps.
Chicken bumps, and the most common areas are arms, cheeks, and legs. Those are the common places for it, but it is an autosomal dominant. About 25% of people in the population carry the trait, so it's really common.
It's very common.
Yep, and if you carry the trait, half of your kids will have it.
And they don't have it from birth, and so what ends up happening is they don't really notice it when they're first born, but by a year or so, at some point into it, the parents start to notice their cheeks are always red, or they're a little bumpy, or the arms, or the legs.
And it does tend to get a lot better on puberty when you go through puberty and you get a little bit more oil production. It helps soften those plugs. It's kind of like a cork in a bottle, so you don't want to be real aggressive with scrubbing it, because that will just irritate it. People with keratosis pilaris have much more eczema, so you really don't want to be too aggressive with it. The acid-based creams, I usually don't recommend those in babies just because they tend to irritate. So just moisturizing helps. Gentle cleansers, moisturizing, but anything that has urea, salicylic acid, or glycolic acid, all of those things, like Amlactin has lactic acid, CeraVe SA has some salicylic acid. So there's different products over the counter, but usually those aren't well tolerated until you're about a teen.
Right. So it's usually the teenagers where it bothers them. It's almost like they don't have acne, but they have this. And
instead. The kids that have keratosis pilaris don't get as much acne. That's the trade-off. Is that
I did have pretty good skin.
Yeah, that's why. See? Ding,
ding,
ding.
Love
the skin you're in. Love the skin you're in.
Actually, all my kids are all pretty good skin.
See?
So I did also want to touch on birthmarks, because a lot of babies are born and they have a mark. And the one that was common that I ended up seeing that doesn't show up at birth and then it starts to show up is a hemangioma. And every time I see a baby with a hemangioma, I do offer usually a topical treatment for it, because now that we have very tolerated topical treatments, and the whole idea of a hemangioma, and you can describe it, one is, but the way I describe it to parents is it's this collection of capillary vessels. It's just this blood vessels that essentially starts to grow, but it really kind of can grow for the first year. And I can't really predict how much. I mean, you can sometimes start to see how much bigger it's getting, and you can say, oh, this is big. And there's definitely, if it's in certain locations, it's back to location. Or if you have, say, too many of them, that's definitely
can be an issue.
Yeah, let's get to a pediatric dermatologist. But in general, most of the time, they're small, and they're usually like on your forehead, or you see the little babies on the nose, and poor thing, because it looks like Rudolph a little bit. Or their arm or their butt or somewhere. It's always somewhere. I feel like it's more in girls. I could be wrong.
No,
but
that's
I feel
true.
like
it's true.
Girls. And you do have a topical medicine that's pretty effective at it. I'm kind of trying to stop the growth of it so that it doesn't suddenly be bigger. Because then later that could have more implications with needing laser or something to be done later. So what are your thoughts on hemangioma, and what are your thoughts on systemic treatment of hemangiomas, which most people do not need?
Most people do not need, right. So hemangioma is very common. 1 in 10 babies is going to have a hemangioma somewhere on their skin.
Google it.
It's more common in girls.
Yep.
More common in low birth weight babies, but we see them in normal birth weight babies all the time. And the most common area is definitely head and neck. So the majority of them are going to be on the head and neck. They are a tumor. They're benign. They have no cancerous potential, but they are considered a tumor or a growth.
Tumor just means growth.
Just means growth. Benign, totally benign, no cancerous potential.
Yes.
But when you look it up, it is considered a tumor. It's made of blood vessel type cells. And it's not like a bag of blood that's going to burst and explode and bleed all over. It's more like a juicy orange. If you were to cut into it, it's more like a juicy orange. So it will ooze a little bit more, but I know parents always worry about bleeding. It's rare to have significant bleeding from hemangiomas. And again, location is exactly right. Most hemangiomas don't need treatment, but certainly ones that are by the eye can affect the vision. Ones on the nasal tip can actually cause the cartilage to be displaced and the nose to form incorrectly. Ones by the ear can affect hearing. Ones in the diaper area tend to get ulceration or sores. Those are ones that can do that. Ones on the fingers and toes can also cause problems. So those are ones that kind of need more evaluation usually. If you have multiple hemangiomas, 5 to 6, sometimes you can have internal hemangiomas.
Or if they're in this bearded distribution.
In the bearded distribution, you can sometimes have them inside the throat and can affect breathing and things. So again, that's rare. Usually it's location, and that's why it's good to get in with your pediatrician. They do tend to go through this growth phase initially where you don't necessarily see them at birth, or maybe it looks like a bruise, or it's very pretty indescript at birth. And then usually at about 4 to 6 weeks is when we start seeing them grow, and then they grow really rapidly for about the first 3 to 4 months. Like when they start coming, it's scary to watch because it's like you put them to bed and they wake up and it's bigger, and that's just what they do.
It's a tumor.
It's a tumor. It's a growth. It's growing, and it's going to grow. And they grow up until about a year of age, but the really rapid growth phase is about 4 to 6 months. And then they kind of slow down. There's 3 different types of hemangiomas. There's superficial, which are just the red ones. There's the deep ones where they're just kind of purple and they look like a knot under the skin. And then mixed is probably the most common, where you get a little superficial redness and then the deep component underneath it.
Right.
And yeah, interestingly, this medicine, the medicine that you're recommending, Timolol, it's not FDA approved for this, but we use it off label all the time. And there are studies that show that it's safe and effective in babies. And it is well tolerated. And it's interesting because how they found this several years ago in France is babies that had heart issues related to their hemangiomas, which again is very rare. They put these babies on these blood pressure medicines for their heart, and they found that their hemangiomas went away.
Called beta blockers.
Beta blockers, propranolol, and the branded one is hemangilol, which is what I prescribe. It's a little better tolerated, I think. But it is the oral one, and that we usually only do because there can be some issues with low blood pressure, low blood sugar.
It's checking kgs.
So, and we've really found that you don't really need to check any kg like we used to. When we were first starting to use it, a lot of us would even admit patients to the hospital to start doing treatment. But now we found that most healthy kids are going to tolerate it fine, so you can start it on an outpatient basis without doing a big workup.
But most people don't need it.
Oh gosh, most people don't need it.
And so what we found was that there was a topical, which is actually a glaucoma medicine, Timolol, which is an eye drop.
Yep, which is the same medicine, propranolol, in a topical version.
But you don't really get the systemic absorption.
Right.
And it does a great job.
It does a great job.
Arresting the development of it.
Right, and it buys you a little time till they kind of figure out, their bodies figure out how to regulate blood pressure and blood sugar. So a lot of times we'll start with the topical and then transition to the oral if it's not responding or is one of those. But I've had a lot of
in a dangerous location.
In a dangerous location, exactly. So, but it's really important, I think, to get in quickly and get treated quickly because you want to catch it in the active growth phase. So the wait and watch kind of scenario that some people do, not advisable. Like you want to get in, discuss it with your pediatrician, and the pediatrician needs to refer early if they, think treatment is appropriate for their patients.
Right. Yeah. And I would even say a good number of pediatricians are still behind on that one and not knowing that it's out there.
It's watch and wait, and then they come in at 6-8 months, and I'm like, gosh, if we would have started this medicine 3 months ago, we could have made an impact. But now, when you get to a certain level, it's not going to make it go away. And that's another thing I counsel families on when we start treatment. If it doesn't grow, that's actually a positive response because it would be growing if we didn't do treatment. So arresting the growth and stopping it is actually a positive response.
That's all you're really trying to do, actually. It's not going to magically go away. That's going to take time.
Right. And they do go away on their own, and most of the time Mother Nature does a better job than a surgeon of taking them away without a permanent scar.
So we're almost out of time, so I'm going to hit you with the bullet things, and then we're going to say goodbye. Favorite sunscreen?
Favorite sunscreen, Vanicream, the 30 and the 50. Not the sport, because it does have chemical, but just anything that has plain zinc oxide and plain titanium dioxide. You don't have to go above a 30 to get much benefit.
Okay.
So as long as it has SPF of 30, but Vanicream by far.
Favorite mosquito spray?
Oh, so mosquito sprays.
About this all the time.
Yeah, mosquito sprays are hard. I have to tell you, there's none that I totally love out there. Now, interestingly, permethrin, which you can get at like Academy, you can put it on the clothes and it stays on. And that I kind of like a little bit better than sprays that go on the skin. So that's kind of my bite blocker is one that you can get. It's got more natural oils. You can get that online. It doesn't have the best smell in the world, but it's better tolerated. I'd probably say that's my favorite sunscreen. But again, a lot of times
mosquito spray.
Yeah, mosquito spray. Sorry. And you don't want to actually do mosquito spray and a sunscreen because you don't get the benefit of either one. Like you really want to do those separate.
Oh, okay.
Yeah.
So do them separate. Okay. Yeah, mosquito spray is tough.
Yeah, mosquito spray is tough. Bite blocker is probably my favorite, but the permethrin sprays that you put on the clothes, I like that a little better.
I was not paying attention, but I had one that came in a wipe once.
Yes.
And I used it on my face. All I can tell you is my face turned bright red and swelled. And so I don't remember which one it was. And to this day, I'm like, oh, I don't know.
Yeah.
Like, it wasn't worth all that.
No,
So,
no.
So I wear some long clothes and try to protect myself other ways.
Yep.
So there are other things. So that was 45 minutes of dermatology fun. Hopefully you found this useful. So I will, remind you, I am on the board of a Children's House of Soul, which is an awesome organization. And then they are having the fundraiser that's coming up next Friday night. It sounds like it's going to be fun. It's adult only.
Yes, fun.
So that,
totally
as
fun.
my husband says, means it's really fun. And so they can definitely always go to the website, and we'll put that on there in case you want to come join us for fun. I always said I'm a big geek. Dr. Bree is right there with me.
Yes.
But we're fun geeks, so that's fun. If you end up having more questions, feel free. You can leave them. We're pretty good at replying. But thank you for joining us, and thank you for coming.
Thank you. It's
All right. Thanks. Bye.
Bye-bye, guys.
Not that we know how to turn it off.
Yeah, and it's still going.
Yeah. There you go.
Bye-bye.
No, you just reversed it.
I just reversed it.
That's okay.
All right.
Finish.